Welcome to video number 1 about cognitive behavioural therapy, also known as CBT. Cognitive behavioural therapy is currently the choice therapy, the choice talking therapy for mental health, basically in the Western world, and seems to have taken over from other things and other therapies, mainly because it's cost effective. It was formulated in the middle of the 1950s by a guy called Beck, and it's grown in popularity. It doesn't take as many sessions as the older therapies such as psychoanalysis, which can take years, and it's easier to learn in terms of making formulations which are the basis of assessing someone and choosing the right kind of route for them. CBT is also based on a set of protocols by a couple of guys called Roth and Pilling, and those protocols gave directions on how to treat certain mental health conditions. The aim of this is that you can get a standardized therapy together so that you can treat people according to their presentation, and that therapists can learn to treat people according to that presentation. So there's like a flow chart. So if you come in with anxiety or depression or OCD, CBT offers a flow chart to go through called the protocols, where you can choose certain remedies to help people. So that's the basis of CBT. CBT in itself is about thought, which is the cognitive element, and behaviour. So there is a strong emphasis on changing the way we feel by changing the way we think. There's a very famous book in CBT called Mind Over Mood by someone called Podetsky, and in that she talks about it is what it says on the tin, changing the way we feel, changing the way we think to change the way we feel, so that our feelings change. So for example, if you're feeling panicky or anxious in a particular shop or in a particular environment, then by changing the way we think can change the way we feel. So that makes sense. So we adopt different thinking patterns, and we try to eliminate negative automatic thoughts in order to change the way we feel, because sometimes we feel bad and then we can tell ourselves bad things. Automatic thoughts pop up in our head such as I'm no good enough, I can't cope, things like that. So that can lay us low. So basically CBT is about examining the way we think, trying to make ourselves think in a more positive or productive way in order to change the way we feel, and obviously to eliminate negative feelings and negative behaviours that may ensue from that. CBT in itself has a long history of evidence and corroboration that backs up its efficacy. So in other words, it's a very effective treatment. Many CBT practitioners are accredited, which is a very difficult process, and it seems the accreditation itself seems to complicate what could be a self-administered system. So at the moment in the NHS in the UK, there are huge waiting lists for CBT practitioners, and because of that it's created a kind of glut and a kind of area whereby CBT's become popular because it's rare. So just as gold is popular because it's rare, CBT's become that, and so it's gone up in value, and because of the waiting list, everyone thinks this must be a fantastic thing. It must be the silver bullet. If everyone wants CBT, it must be fantastic. What am I missing? The waiting lists are high. Now the waiting lists aren't necessarily high because CBT itself is good. They're high because the NHS has been starved of money. So the waiting lists give a false impression that CBT is the silver bullet, And I have many patients and clients coming to see me who think that CBT is going to be a cure-all, a panacea, and a solution for what they're waiting for, when in actual fact there are a huge number of talking therapies that are available, including counselling, dialectical behavioural therapy, mindfulness, so many things, transactional analysis, psychodynamic work, too many to mention basically. So CBT isn't the only thing, but it's perhaps the most cost-effective thing, and it's certainly the thing with the highest waiting list. So as I said before, waiting lists don't actually mean that the therapy is going to be useful to you, and certainly there are many CBT self-help books that have been written by great people who write books that go to Oxford University and work at the Oxford Centre for CBT in Oxford. So you can do a lot of self-help. But really, the concept of the Podetsky book that I mentioned earlier about being mind over mood, if you can somehow challenge and alter negative thoughts, then you can take some control over your mood. And in this series of videos, I'm going to be talking about how you can do your own CBT without the need of a CBT practitioner necessarily. Certainly, if you can join a waiting list and wait for 9 months, or in some areas 12 months, the thing about that is your problem might have gone by the time you get to see somebody. But the other thing is that you might be waiting and your problem might be getting worse. Well, if that's the case, you've got two options. You can either self-help, or you can, if you can pay for someone to see privately, or you might get it through health insurance. So what I'm saying is that CBT itself is not a silver bullet, and you don't necessarily need a practitioner. As I said earlier, there's a false assumption that because waiting lists are high, they're very good. Like a Ferrari, for example, you've got a waiting list to buy a Ferrari, you've got a waiting list for various things that actually are very good. But sometimes you've got waiting lists for things just because there's a shortage. And very often when you get there, it's not as good as you thought it would be. Quite commonly, I see people who've actually seen CBT therapists, and they come and see me, and I ask them, how was the CBT? How did it go? How did things go? And they'll say things like, well, it wasn't great. The practitioner just sat there, gave me a few sheets of paper. All she did was fill in a few forms and ask me some various, went through a questionnaire. It seems like a tick box thing. It seemed like that they didn't engage with me. There was no eye contact, or someone sat at a computer. So those people are obviously doing CBT by rote, as the Americans would call it, and not necessarily engaging with the patient. So what they're doing is they've learnt it from a book, or they've learnt it from a course. They might be good at passing exams, they might be good at getting degrees, but they're not necessarily good at engaging with people as a therapist. And that's the important thing. Without a therapeutic alliance, nothing will happen. So whatever the choice of therapy is, it's no good unless you actually engage with someone. So that's why, well, it's just one of the reasons why CBT in itself isn't necessarily the panacea and the silver bullet to cure every ill. So in this series of videos, I'm going to be looking at how to use CBT yourself, how to avoid the waiting list if that's what you want to do, and how to look at life perhaps in a different way. It's obviously up to you how you look at life and what you do in life, and that's not the job of any CBT therapist to say that you're thinking in the wrong way, or that you're not doing the right thing in life. That's up to you. So we'll be looking at that in the forthcoming videos. But please rest assured, if you're on a CBT waiting list at the moment, it might not be the cure-all solution that you are hoping for. So if that's the case, don't despair, because there is hope and help, and I'll be looking at that in forthcoming videos. So until the next time, thanks for watching.